would like to introduce the Partnership for Drug-Free New Jersey's Director of Opioid Response and Prevention Outreach, Angela Conover. Angela.
Thanks, Greg, and good morning, everyone. Welcome to this month's Learning Series webinar, the Knockout Opioid Abuse Day Learning Series webinar, Saving Lives, Harm Reduction, and the Opioid Crisis. Today's webinar is brought to you by the Partnership for Drug-Free New Jersey and is being held in collaboration with NJ Cares and the New Jersey Office of the Attorney General. And I thank them for their partnership, support, and collaboration on today's learning activity and throughout this year-long learning series. I also want to thank all of our attendees for joining us today for this important conversation. I'm so pleased to introduce our featured expert speakers who are with us today. We have Richard LaRosa. Richard is a person in active recovery who shares his experience, strength, and hope with anyone who is searching for inspiration. We have Charlotte Kusar with us. Charlotte is a program management officer with the New Jersey Department of Health Division of HIV, STD, TB services, where she also serves as coordinator of harm reduction and ARCH programs. And we have Catherine Neisel. Catherine is a health educator with the Rutgers Robert Wood Johnson Medical School Division of Addiction Psychiatry. She's a certified health education specialist with a degree in public health. So I want to thank all of our panelists for joining us today. We're going to get started. I'm going to introduce our first speaker, Richard LaRosa. Richard is going to speak to us really about why we're all here today. We had an opportunity to speak and learning about Richard's work and really it's an inspiration. He's really the face of the issue of why we're here today. So why we're here today and why we continue the work that we do. So Richard, thank you so much for joining us this morning. Welcome.
Thank you, Angela. It's a pleasure and it's an honor to be here. Last week, I work out of the New Jersey Attorney General's office for NJ Cares. I work for the CDC Foundation. Last week, I had the pleasure of going to the EMS Summit in Atlantic City, and it was a very emotional day for me. 6 years prior to that, I got asked to speak at the Gloucester County Prosecutor's Office and how recovery coaching helped save my life. I went outside to go smoke a cigarette, and there was two women out there, EMS. One woman turned and said to the other woman, "I don't know why I do this anymore. I don't know what the purpose is of me doing this." And the other woman responded that she understood what she was saying, and she already had her letter of resignation all typed up. And after the conference, she was going to email it over. And I looked at him and said, "I know why you do what you do." And they tried to read my name badge, and I covered it up, and I told them, "This isn't important, this badge." And she said, "Why do we do what we do?" And I told them, in 2015, I said, "Yous came out and helped me 6 times. 6 times you Narcaned me and put me in the bus and brought me to the hospital in 2015. I said in 2016, January, was my 7th reversal with Narcan, my 7th ride in the bus to the hospital, and it was my last ride. After that experience of me almost dying and waking up and yelling and screaming and being so bitter and mad and angry, that was my last trip to the hospital. And I told them, "This is why you do what you do, because you give people like me a second chance, a 7th chance." And it gave me an opportunity to finally get my life together. When I woke up and I was yelling, and the nurse came in and she was laughing at me, She thought I was mad because they took my high away with the Narcan. And that wasn't the case. I said everybody would be better off dead if I was dead, and I went to sleep and it was peaceful and I wasn't suffering. I wasn't in any pain. And now you bring me back to this. And the doctor came in the office, in the room, and he said, you don't have to die from this. You can go get help. And I laughed at him and I said, I stick needles in parts of my body. You as a doctor wouldn't even think of sticking a needle in somebody. And he said, you can get help and you can get better. And he walked out. The cop was standing in the room with me. I thought I was under arrest. And I asked him, I said, are you locking me up? And he said, no, I just happened to be passing by when I seen you lying on the ground. So I turned around and I went back. After trying to revive you and not having any success, I went in your wallet and I looked at your last name. And when EMS and the paramedics came, I told them to work on this kid. We got to save him. He went through the police academy with my little sister, who is a decorated narcotic strike force sergeant out of the Gloucester County prosecutor's office. And she hasn't spoken to me in 17 years. None of my family, except my wife, was the only one that stuck by me. Not my kids, not any of them they didn't want to have anything to do with me. And he said, if you were to die, I didn't want your family to think you died alone, and I was here with you. And this cop showed me compassion, and he cared. The EMS and the paramedics, they treated me with respect. They didn't treat me like I was a piece of trash on the street. And that kind of made me feel a little better about myself and thought maybe I wasn't so bad. So 2 months later, I had another accident. I didn't overdose. I could have killed my granddaughter in an accident. And after that day, my wife said, what are you going to do now? And I said, I'm going to go away. I'm going to get help. And I'll never disappoint any of yous ever again. And that's what I did. Today, I'm a son. I'm a husband. I'm a brother. I'm a father. I'm a grandfather. And I work really hard on myself. And I work just as hard in helping other people. And I dedicated my life to helping people, just like me. That's why these EMS workers are doing what they do. Today, I share my office in my home with a 6-year-old granddaughter. She's the boss. I could never do that if it wasn't for Narcan. Gave me a second chance on life. And all the support with the Attorney General's office and everybody being there for me and allowing me to come out and help. And it was all volunteer for the first 5 years. And they offered me a job and I took it. So now I get paid for doing what I absolutely love to do. Thank you for allowing me to come out and giving me this opportunity to share a little bit of my story with you.
Thank you so much, Richard. What a powerful and inspirational way to start this conversation. And really, you're a living testament to hope and to the reason that we're here today, right? Talking about harm reduction and naloxone. And so I so appreciate you speaking with us today, and so appreciate the work that you've dedicated your life to. Really appreciate you being with us this morning and really showing us, like you said, I know many of us oftentimes feel like those EMS workers, but there's no bigger inspiration than you this morning. So thank you again for joining us this morning. Thank you.
Thank you so much.
So as we heard from Richard, it's so important to understand and to utilize harm reduction strategies. And so I'm so pleased that we have Charlotte Cussar with us today to talk to us a little bit about what's happening here in our state. So I'll turn the presentation over to you, Charlotte.
Thank you so much, Angela, and good morning, everyone. Thank you for having me. I'm going to go ahead and share my screen really quickly. Okay, hopefully you all can. Did I just move it? Okay. Okay, Angela, can you just confirm that you can see the screen?
I can. Everything looks good.
Perfect. Okay. Okay, so again, my name is Charlotte Cussar. I'm a program management officer as well as coordinator of harm reduction programs here at the New Jersey Department of Health in the Division of HIV, STD, and TB Services, also known as DHSTS. And I am happy to talk about harm reduction at NJDOH today. So I will just start with a kind of basic definition of what is harm reduction, because I know we have a mixed crowd today. Harm reduction is a concept in public health and addictions counseling that acknowledges that while a person may not stop engaging in high-risk behavior, there is value in promoting behaviors that reduce overall harm. And the harm-reducing behaviors mitigate the potential dangers and the health risks associated, right? It doesn't mean stop, it just means let's reduce the harm or potential harms of this behavior. And we have harm reduction all around us, actually, in our lives. And you can see some of the examples on the screen: sunscreen, seatbelts, the filters that are in cigarettes, speed limits, birth control, safer sex. All of these are designed to kind of lower the risk or lower the potential harms of a certain behavior, not to just eliminate the behavior altogether. And so why a harm reduction model? Research shows that harm reduction increases public health and well-being without increasing drug use, violence, or crime. And according to the CDC, people with access to syringe access programs are less likely to die from an opioid-related overdose. They're 5 times more likely to stop substance use that causes them problems, 3 times more likely to stop substance use altogether, and 50% less likely to acquire HIV or hepatitis C. And so, again, I just want to kind of drive home the point that this is all about reducing harm. And for many folks, engaging in a harm reduction model does eventually get them to a point where they are ready to stop substances altogether. And for some folks, it doesn't, and that's okay. It's all about, making their lives safer and reducing the risks of serious, or harmful consequences. And so what's happening with harm reduction in New Jersey? So there was a legislative package signed by Governor Phil Murphy in January of this year, and it expands harm reduction services and efforts to end the New Jersey opioid epidemic. And so included in the bills are some new items. They authorize the distribution of sterile syringes, decriminalize possession of syringes, and also allows for expungement of previous possession cases in certain circumstances. And then also establishes local overdose fatality review team. And so this entire package was really exciting to the New Jersey Department of Health, and it allowed us to think about harm reduction expansion in a more broad and more comprehensive way, even more than what we already had in place. And so we're very excited about what is to come in the future and how we can best help New Jerseyans in the opioid crisis. And so currently there are 7 existing harm reduction centers that are funded by the New Jersey Department of Health. They are a mix of both mobile units and brick and mortar locations, and they're listed here just in geographic order. So we have Paterson, Newark, Jersey City, Trenton, Asbury Park, Camden, and Atlantic City. Those are all the blue dots on the map. And then also you'll see some cities with the orange stars, and these are locations that have been proposed. This is not written in stone, I do want to emphasize that, but these are locations that have been proposed based on data as potential new spots for harm reduction as we continue to expand. And we continue to look at the data and look at where services would be best or most needed, I should say, or best serve the community. Eventually, our goal is to have a harm reduction center in all 21 counties in New Jersey. As you can see from the map, there are areas of our state that are definitely lacking in terms of access to these services. And we know that our more rural areas, especially in the southern part of the state and kind of, here on the side, Sussex and Warren County, have less access to public transportation than our more urban centers. So that is something that the New Jersey Department of Health is aware of and is keeping in mind as we look to decide where new harm reduction centers will be stood up. And so for those who have not been to our harm reduction center or are not familiar, here are some of the services that individuals can access at each center: trauma-informed harm reduction education sessions, harm reduction supplies and education, safer sex supplies and education, safe disposal of injection equipment, overdose prevention education, and naloxone and fentanyl test strips. This is one of our major services that we provide at our harm reduction centers, is making sure that our clients receive their naloxone as well as fentanyl test strips, because fentanyl has seen a rapid rise in the drug supply in our area, across the country really, but especially in our area as well. Clients can also receive referrals and linkages to drug treatment if they so choose, to medical care, social and mental health services. Our harm reduction specialists are really adept at linking clients to whatever it is that they might need to help better their lives and better their situations, depending on what's happening with each client. Each current harm reduction center is also co-located with an ARCH nurse. And so they are able to provide things like wound care and additional, harm reduction education, STD testing, pregnancy testing, all sorts of nursing services that our clients can often be in need of, and perhaps may not be comfortable accessing at other locations like hospitals or clinics, where they may just not feel comfortable going, or they may feel judged. So we have those services at our harm reduction centers that can be welcoming and trauma informed and kind of a non-judgmental space for those who are looking for that. Some of our harm reduction centers also have drop-in centers, and then our low threshold buprenorphine programs, which I will do on our next slide. So our low threshold buprenorphine pilot program has now been expanded to all 7 of our harm reduction centers in New Jersey. And through this program, clients have access to buprenorphine, which is prescribed by a licensed provider. They will have case management and peer support, and referrals to additional substance use providers for continued treatment if they so choose. And so moving forward, the Department of Health is looking at a very kind of pragmatic, incremental approach to harm reduction expansion. Short-term expansion goals are to rapidly implement mobile harm reduction and naloxone distribution. Intermediate goals would include transitioning mobile services and targeted naloxone distribution to more comprehensive harm reduction centers. And then, as I stated before, our long-term goal is to establish at least one brick and mortar location in each of our state's 21 counties, so that we can ensure that all of our communities have access to harm reduction services. And so right now we're just focusing on the rapid implementation of these services and ensuring that clients are able to access them and expand our opportunities to serve in various spaces. So I tried to pack a whole bunch of information into a short amount of time. Thank you very much. This is my contact information, and I'm sure that it will be shared after the program.
No, well, thank you so much, Charlotte. And thanks for that information. I think it's so great to be able to see what is happening and how we can interact with what is happening at the state level. One question I had before we go into our training, you mentioned looking to expand into the other counties, and I know I saw something in the chat specifically looking at, Phillipsburg and Warren County. And so is there a way to advocate, or what is the process in determining where the next location will be? And how
Sure.
can we support that, our attendees? Yeah.
Sure. So currently, the statute that was put in place, the department is kind of writing the rules, if you will, as to what will be required to be a harm reduction center. What are all of the particulars that will go into it? How does one apply to, become that? And so all of that is in process right now. And so when that's done, of course, we will announce that to the public and make sure that everyone is aware of how to access those things. And as I said, the cities that were marked as kind of potential new harm reduction centers, it's not set in stone, but it is based on data that we have currently of where things might be needed most.
All right, great. Thank you for that additional information. Appreciate that.
Sure.
And so we're going to move on to our next speaker, who's going to actually provide us with a training on naloxone. But Charlotte, will stay with us. And so if there are any additional questions, please put them in the chat and we can get to them at the end of the webinar today. Thank you. So our next presenter, Catherine Niesel from Rutgers RWJ, is going to talk to us about naloxone and how to administer naloxone and give us a brief training on that. So Catherine, I will turn the presentation over to you.
Thank you. Good morning. Thanks for having me. I'm just going to share my screen. Can you just confirm that everything looks okay?
Everything looks good.
Okay, great. So good morning. Thanks for joining. Thanks again for having me. I'm going to be talking about New Jersey's Opioid Overdose Prevention Network program. So first, I just really briefly want to mention our partners. So our funding for this program comes from the New Jersey Division of Mental Health and Addiction Services. We also receive data from the New Jersey State Police Regional Operations and Intelligence Center. And so if there is an outbreak of overdoses in a certain part of the state, we receive that data and then we're able to provide more trainings and give out more Narcan kits to those areas. And again, we're Robert Wood Johnson Medical School. So what does our program do? We prevent opioid overdose deaths by empowering members of the community to appropriately respond to an opioid overdose. We do this by providing free education and free naloxone kits. Since 2017, we have trained over 17,000 participants and we've given out over 18,000 naloxone kits. So on this chart, we can see the continuous rise of all drug overdose deaths in the US from 1999 to 2020. Looking at 2020 alone, we can see there were over 91,000 overdose deaths. And for 2021, we are hearing unofficially that number has reached over 100,000. Looking at those 91,000 overdose deaths, we can also see more than half of those involved opioids. Now, looking specifically here in New Jersey, as of 2020, New Jersey ranked 14th in the country for highest opioid overdose death rate, with a rate of 28.9 deaths per 100,000. So you can see on that chart on the slide that we're not at the #1 spot here in New Jersey, but we are still above the national average, which is 21.4 per 100,000. Here we can see in 2020, there were over 2,800 overdose deaths in New Jersey. Over 2,500 of those, so almost 90% involved opioids. This map shows us the number of naloxone administrations in New Jersey for 2021. We do have to note that these numbers are only being reported by 2 agencies. So this is coming from 2 sources, that's law enforcement and EMS. This isn't taking into account any time Narcan is given to someone by a friend, family member, or just someone in the community. So in reality, these numbers are going to be a lot higher. We can see that this map is broken down by county. So we had the highest number of naloxone administrations in Essex County with just over 2,000. This was followed by Camden County with just under 2,000. We had our lowest numbers of naloxone administrations in counties like Hunterdon, Sussex, and Warren. But these are more rural counties, so they have a lower population density. So we do want to keep that in mind because it is possible that when that is accounted for, those more rural counties may have similar rates or maybe even higher rates compared to those more populated counties like Essex or Camden. On this chart, we can see from 1991 to 2013, the number of opioid prescriptions more than doubled to over 200 million. We can see that number has been dropping over the past few years, and this is for a few different reasons. We thankfully have increased awareness in the medical community now surrounding addiction. We have more alternative pain treatments, and we have things like the prescription drug monitoring system for opioid prescriptions. So what's the path from those opioid prescription pills to heroin? So someone may be prescribed the pills, maybe they get them from their friend or their family or from the street. They use the pills, they build up a tolerance, they become dependent on it. They start to need to take it just to relieve their cravings and just to keep away withdrawal symptoms. Eventually, they may lose access to pills or pills become too expensive to maintain. This is when they move on to heroin because it's cheaper and it's easier to access. And today we now know heroin is mixed with these stronger opioids like fentanyl, and most of what is out there now is no longer pure heroin. So you've probably heard about fentanyl. Fentanyl is a synthetic opioid. It's 50 to 100 times stronger than morphine. Many times other drugs, especially heroin, cocaine, or pressed pills, are tainted with fentanyl, often without the person using it being aware of this. So they don't necessarily realize that they're taking this very strong opioid that may cause them to overdose. We do have to keep in mind fentanyl is a pain medication. It has legally been used for many years in hospitals, pain management centers, and cancer centers. But the patients receiving it in these settings are being medically monitored. They're receiving a dose that is safe for them and they know what they're getting. Whereas outside of those kind of medical settings, we have this unregulated, illicitly manufactured fentanyl. And so we don't necessarily know what's in it or how potent it is. That's what can become very dangerous. So how can you recognize someone who's struggling with an opioid use disorder? You may notice that they're using in larger amounts. They're not able to cut back or stop. They spend most of their time trying to get the drug. It's all they can focus on. They have cravings. They're using it even though it's negatively affecting different parts of their life, whether that's work, school, or relationships. You may notice that they're isolating themselves. They continue to use even though they're aware of possible consequences like overdose. They're also going to develop a tolerance. So you'll notice that they have to take more and more to have that same effect. And last, you'll notice that they're experiencing withdrawal symptoms when they try to reduce or stop using. These are some risk factors for an opioid overdose. This first one, reduced tolerance, is very common in the period of time right after someone has been released from either being incarcerated or from some kind of treatment. This happens because this person was using at a certain amount before they were in that situation. Then they are either incarcerated or they go into treatment and they're not supposed to be using during that time. Their tolerance drops, then they come out and they go back to using at the same amount that they were before. But now that their tolerance has dropped, their body can't handle that amount anymore, and this puts them at a very high risk for overdose during this time. Another important risk factor for opioid overdose is using alone. If you're using alone, there's no one there to call 911 and there's no one there to give you Narcan. Some other important risk factors are using in larger amounts, transitioning to injection from other ways of taking the drug, using opioids with any other substance, including alcohol, having any underlying medical condition, and of course, a history of using opioids. So what's the difference between opioid intoxication and opioid overdose? So opioid overdose is a more extreme version of intoxication. Someone may only be intoxicated initially, and then they can very quickly move into that overdose. When someone's intoxicated with opioids, they're going to be experiencing that euphoria or that high. They'll have the constricted, very small pupils, slow breathing, low body temperature. They're going to be very drowsy and have decreased awareness. And they may also experience symptoms like constipation or vomiting. When someone's experiencing an opioid overdose, the first thing you'll notice is that they're not responsive. They're not waking up, they're not responding to you, even after you try verbally and physically to wake them up. The second is going to be that their breathing is suppressed, slow, and shallow. You may even hear a gurgling sound when they're trying to breathe. This is preventing enough oxygen from reaching their body. This person who's overdosing will also have those pinpoint pupils, low blood pressure, a slow heart rate. You may feel that their skin is cold and clammy, and their fingertips and lips may turn blue from a lack of oxygen. And I do want to add that those first few overdose signs are in red because if someone's experiencing those things and they do not receive medical attention, they are in danger of dying. So if you suspect an opioid overdose, the first thing you want to do is call 911. Next, if they're not breathing, you're going to do rescue breathing. And last, you'll administer your Narcan. So we always want to acknowledge that some people may be afraid to call 911, especially if they're with someone who's overdosed. Maybe they were also using, maybe they still have the drugs on them. So we do have something in New Jersey called the Opioid Antidote and Overdose Prevention Act. This provides immunity from arrest for use and simple possession. It covers both the person who overdosed and the person who called 911. This has been around since 2013, so we've had this here for a while, and this is just to encourage everyone in this situation to pick up the phone and call 911. So what is naloxone? Naloxone is the medication that is used to counteract an opioid overdose. Naloxone is a generic name, so Narcan is a brand name. That is what we give out in our kits to participants, and that's the nasal spray. So that's what it looks like in that picture on the slide. It's an opioid antagonist. This means that it binds to the same receptors that the opioids bind to, and it blocks the receptors. It's safe, it's effective, it's non-addicting, not sedating. It also has no effect if the person does not have opioids in their system. So if I use Narcan on myself right now, I don't have any opioids in my system, nothing is going to happen. So if you were to find yourself in a situation where you suspect an opioid overdose, but you're not sure, please feel comfortable to give that person Narcan anyway, because it should not be harmful to them if it's not an opioid overdose. On the other end of that, naloxone only works to reverse an opioid overdose. So if it's an overdose, but it's from a different type of drug that is not an opioid, it's not going to work, but again, it's not going to be harmful to them either. It acts within 2 to 3 minutes. So if it's getting to be 2 to 3 minutes and there's no response after you give them this person the Narcan, you can give them a second dose, and we do provide 2 doses in the kits that we give out for that reason. It wears off in 20 to 90 minutes. So that's not a very long time, especially when we consider that opioids can last for hours. And this is important because it means it is possible for you to revive someone with Narcan and for them to actually re-overdose when it wears off without taking anything else. This is a reason we encourage all participants to try to stay with the person if it's safe for them to do that. Make sure they're calling 911 and getting them medical attention. So again, if you suspect an opioid overdose, the first thing we're going to do is call 911. If you're with other people, you can assign someone to call 911 while you attend to the person who overdosed. We'll do a quick check of the area to make sure that the scene is safe. We're going to check whether that person is responsive, and we're going to check for breathing. If they're not breathing, we're going to perform rescue breaths. Then we're going to administer our Narcan. So when you use your Narcan, you're going to peel back the foil on the package to remove your device. This is an expired Narcan, so we're going to peel back this foil. We're going to take the device out of the package, and then we're going to place the tip of the nozzle into the person's nostril until your fingers are touching the bottom of their nose. That's how you know that it's in properly. Then we're going to press this plunger on the bottom firmly to release the dose. And notice how that plunger stays up after you've given your dose. So that's how you know that it was successfully used. This plunger is very sensitive, so we want to be careful not to accidentally set it off. We don't want to try to test it first because there's only 1 dose in each device and we don't want to waste it. It's also a very condensed dose, so the person does not need to be awake. They don't need to sniff it or inhale it. It's going to just absorb through their mucous membrane in their nose. After you administer your Narcan, if the person starts to wake up and breathe on their own, we can place them in the recovery position. So this is just them laying on their side facing away from you, and it doesn't matter which side. And we're going to stay with them until EMS arrives, as long as it's safe for us to do that. If they do not respond after those 2 to 3 minutes, we can give them a second dose in their other nostril, and we're going to continue our rescue breathing. So we know that those withdrawal symptoms happen when someone tries to reduce or stop using. These symptoms can also happen when someone is revived with Narcan. So withdrawal symptoms can include things like body aches, fever, nausea, vomiting, stomach cramping. These symptoms can be pretty severe. So we just want to keep this in mind. Once this person starts waking up, they may be feeling very sick and disoriented. They may feel so sick from those withdrawal symptoms that they just want to use again right away, just to relieve those symptoms. They may have an emotional reaction, so they may wake up and feel confused or scared or even angry. There's also that re-overdose risk because, again, the opioids last so much longer than the Narcan. So this is a reason why, again, we do encourage everyone to try to stay with the person if it's safe. Make sure that you're calling 911 and getting this person medical attention. So where can you get naloxone? There are free distribution programs like ours. You can also get it from a pharmacy without a prescription, but it can be very expensive. It may be cheaper for you if you have a prescription, if it's covered by your insurance, but it does just depend on the insurance. So participants who attend our trainings will receive a naloxone kit in a red pouch. Inside the pouch, they'll receive 1 box with 2 4-milligram nasal spray bottles of naloxone. Those are their 2 doses of Narcan. They'll also receive a pair of nitrile gloves and a breathing shield for rescue breathing. And I just want to add, if participants use their kit or the kit expires, we'll replace that kit for free. On this slide, I have our flyer for our trainings. Training participants must be at least 18 and they must either live, work, or go to school in New Jersey. We do offer trainings virtually through Zoom as well as in person. We offer private trainings for groups and organizations, as well as 6 public trainings throughout the month, every month, that anyone can attend. So if you are interested in registering for a training or scheduling a training for your organization, you can visit our website for a list of all of our upcoming trainings, or you can send an email to preventoverdose@rwjms.rutgers.edu.
Thanks so much, Catherine. I think it was so helpful. You spoke a little bit about the Good Samaritan law, and we got a lot of questions on that. So could you expand a little bit about that, or explain that again, what that means and what protections that gives someone?
Sure. So the Opioid Antidote and Overdose Prevention Act, it gives immunity from arrest only for use or simple possession. So only in those specific situations, if they have more than a certain amount on them, it may not apply to that situation. It may not apply if they have a warrant. But generally, it does cover both the person who called 911 as well as the person who overdosed, and it covers them for that use and simple possession.
Thanks. And just one more question before we go back to all of our panelists for some additional questions. And if any of our attendees have any questions, please put them in the chat now. But there is a question about the shelf life of the spray. And you mentioned that this one was outdated. If it's the only one you have, can you use it in an emergency? Is the specific question we received, but any feedback you can provide on that?
Sure. So up until recently, the expiration has been 2 years. So I know recently the FDA extended that to 3 years. That doesn't apply retroactively to kits that are currently out, but the new ones going out will be 3 years. If you are in that situation where you only have an expired Narcan, the official answer from Narcan is throw it out if it's expired and get a replacement. If I personally was in that situation where I only had an expired one, I would use it.
All right, thank you. Charlotte, we had a question for you. You talked about the different harm reduction centers in the different communities. So the question is, if I don't live in a specific community or county, can you still access a harm reduction center within the state?
Yes, absolutely. Our harm reduction centers are open to all clients from everywhere. No matter where you live, you can walk in the doors and receive the services that you need. So you don't need to be a resident of that specific county.
All right, great. That's very helpful. And Richard, we have some questions. I mean, how do we talk to our family and friends who, you know, may need help and may need to access treatment? The question is, you know, they keep naloxone in their home, but, you know, are there any other strategies that they can use to help their loved one, you know, access some treatment or, you know, go to one of the harm reduction centers?
I put my information, I put my email, I put my direct phone line. Anybody can call me at any time. I do believe that a person with a lived experience that knows what their loved ones are going through would be kind of a little bit more easier for that person to relate, because everybody wants to tell us what to do all the time. You got to go to treatment. You got to go to sober living. You got to use and just stop. Why can't you just stop? And sometimes it's not that easy to just stop. But I tell family members to continue to support and just love. Tell them every day you love them, whether you're sending it in a text or a phone call or going into their room at nighttime if they're still in your house. It's important, because like if God forbid something should happen, then you got to beat yourself up, and it's all the woulda, coulda, shouldas are going to come into play. And at least you get to go to bed at night knowing that your child was loved and you told them you loved them and you were there for them. Sometimes it takes an overwhelming breakdown to have an unbelievable breakthrough. And if you can get connected with a recovery coach or a peer in your area to try to help your kid to walk alongside them in their path to recovery. And I mean, love is what helped me.
Thanks, Richard. Catherine and Charlotte, any age restrictions on any of the things that you guys talked about, whether accessing a harm reduction center or Catherine utilizing the naloxone?
Sorry, I was trying to let you go. there's no age restrictions. You know, our harm reduction centers serve whoever is in need.
Our trainings are 18 plus, but Narcan can be used on any age.
All right, great. And we're continuing to get questions on how to access naloxone. And I know a lot of the Hope One vehicles and the Operation Helping Hands provide them, but can each of you just speak to, from your perspective, where the best way to access naloxone would be? And Richard, we'll start with you.
You can walk into any one of your pharmacies, CVS, Rite Aids, Walgreens, and if you have health insurance, you have to pay a copay. If you have state insurance, Medicaid, you have no copay. In a pinch, when I'm out, I can call to order it, but if I want it on hand, I just go to the pharmacy and I get my naloxone and I have it ready and available.
All right, thanks. I think we're going to put some information in the chat as well from the AG's office. But Charlotte, can you give us your feedback on that?
Sure. You can access naloxone at any of our harm reduction centers. And there are actually lots of programs, around the state that are also involved in that process as well. But you can access naloxone for free at our harm reduction centers. No questions asked.
All right, great. And Catherine?
Sure. So again, if you register for one of our trainings, it's about an hour. You can attend online on Zoom, and we'll send you a free naloxone kit with the gloves and the breathing shield as well. And again, we'll replace that for you if it expires or if you use it.
All right, great. And Catherine, just one follow-up question for you, and not sure if you have the answer to this, but is there any temperature concerns? Like, how should it be stored? Can you leave it in the trunk of your car? Is it something that has to stay in the refrigerator? Any information on that? And then if any of the other panelists want to jump in after Catherine.
Yeah, we recommend keeping it at room temperature if possible. A lot of people do ask about keeping it in the car, which if that's what makes the most sense, we're not going to tell people not to do that. But just with the extreme temperatures in the summer and winter, it is medication, so that could affect how effective it is. So we just want to be aware of that.
All right, thanks. And Charlotte, not sure if you had anything you wanted to add with that?
In terms of storage temperature, I don't have anything to add.
No.
I think Catherine covered it.
And Richard, anything about storage?
I carry it with me because I got a bag I carry, and I just keep it in there. I don't leave it in the car in the summertime because inside your car can get up to 140 degrees. I try to keep it with me. But as far as the expiration goes, I remember in 1985, I found medication from 1976 that was no longer made, and I took it back then, and it was just as potent and powerful in 85 than it was in 76. So if you have Narcan and it's expired, everything has to have an expiration date on it. I suggest use it, call 911.
Yeah, definitely. Call 911. I think universally, guys all said that. We're coming to the end of our time, so I want to just give all of you the opportunity to leave one last thought with our attendees who are with us today. Charlotte, we're going to go ahead and we'll start with you. Something that you want our attendees to leave with from your perspective.
Sure. Kind of following Richard's lead, I just want folks to remember that harm reduction is about reducing harmful behaviors or risky behaviors. It's not necessarily about stopping substance use altogether. And so for anyone in your life that may have an issue with substance use, continue to support them as best as you can through that process until they find their own path.
Oh, thank you. And Catherine, any final note for our attendees today?
I would just say if you suspect something might be an opioid overdose, give them Narcan, call 911, it might save their life. And if you're interested, definitely recommend registering for one of our trainings.
All right, thank you. And Richard, you were our inspirational first speaker. And so want to leave you with the last word for today. Again, we have an audience of people who are directly impacted. We have people who work in the field. We have family and friends of those who are suffering. So just knowing who our audience is, any last word?
Well, the road to nowhere can lead to all of us. When they're ready to decide they want to give this a chance, we're here, we can give them hope. And our recovery coaches and our people in harm reduction at the sites, at first, I'm not going to lie, I was against a lot of things. And because I was like 12-step beat up and thinking there was one way, and there isn't just one way. It's about saving lives. It's about prolonging somebody's life and giving them the opportunity like I was given and a chance to make a change in their life. But the road to nowhere can lead to us, to each and every one of us. And we don't have to be a number. We're people. We're somebody's son, daughter, mom, dad, brother, sister, and we matter, and all lives matter. Just because we did bad things don't make us bad people. We just made bad choices. I love you all. Thank you for letting me be a part of this, and God bless.
Thanks so much, Richard and Charlotte and Catherine. I really appreciate you all being with us today. I think that hopefully, along with all of our attendees, we all feel more empowered with the work that we do, but also have tools, right, where we know where to go, we know how to get training, we know how to get to a harm reduction center now, and really appreciate you all being with us today, including all of our panelists. Want to encourage everyone, if you haven't already, please complete the survey and evaluation that popped up on your screen. We've included a number of phone numbers and contact information in the chat, so we'll leave the chat on for a few minutes so to make sure that you guys can copy all of that. I invite and encourage you all to attend our last webinar of 2022. It's going to be held on December 8th. So please join us if you can. We're going to take a look back at 2022 and the data and really see where we are and where we've come from the beginning of the year and get a nice snapshot of what's happening in the state. So again, I want to thank all of our panelists, our expert speakers, and also all of our attendees. Thank you for being with us today. Have a good day, everyone. Be well.